So urinary incontinence is a devastating symptom for a lot of patients. It's something that really affects their quality of life in a way that is not matched by erectile dysfunction or other symptoms. So anything that we can do to restore their continence is a huge impact on them. Most of the time, urinary incontinence that we see is caused by prostatectomy or surgical removal of the prostate for cancer. It can be caused by other procedures on the prostate, most commonly, like procedures for enlarged prostate. It can be related to radiation. Sometimes it's related to a spinal cord injury, but most of the time it's removal of the prostate that causes it. This happens in almost every patient who has their prostate removed, but most patients are able to recover their continence in the months following surgery. If a patient has not recovered their continence within 12 months of the prostatectomy, they will not get any more continent with more pelvic floor therapy or time. And that's something that a lot of patients and physicians are not aware of. So fortunately, we have a lot of patients who are suffering with incontinence years after their prostate removal, and nobody has told them that it's not going to get better on its own, and we have to do something about this. So what we do really depends on the patient and the severity of the leakage. The basic management is pads, and there's a penile clamp that can be used, sometimes called a Cunningham clamp or a continence clamp, that goes over the penis to help prevent the leakage. That's, as you can imagine, very uncomfortable and not something that should be left on all day long, as it can cause damage to the skin. So for patients who've tried that and don't want that, there's basically two surgical treatments for urinary incontinence. There's no medicine that helps with this type of incontinence. We're talking about stress incontinence, or incontinence that happens with coughing, sneezing, standing up, movement. It's not the type of incontinence that's urgency related, meaning you get the urge to urinate, and if you don't get to the bathroom quickly enough, you'll leak. That's a separate issue. For stress incontinence, there's no medicine that will help. There's only two surgical options. The most simple and basic one is called a urethral sling. That is a one-piece simple device. It doesn't have any pumps or buttons. That provides a good option for men with mild incontinence, meaning that they're only really using 1 to 2 pads per day. And we try to quantify this level of incontinence by the patient-reported number of pads that you're using in a day, or an exam by just having the patient stand and cough and seeing the degree of leakage that happens with that. We also do not offer slings in men who've had radiation for prostate cancer or other cancers, because it has a high risk of not being effective or having a sling erosion. We also only offer slings to patients who've had their prostate removed for cancer. It doesn't work really well for incontinence from other causes. So it's really only a minority of men with incontinence who are good candidates for sling, and it's a less common procedure. The main reason why we don't offer it to men is because their incontinence is too severe. For men with moderate or severe incontinence, the sling does not provide enough support to get the patient adequately dry. So for those patients, or patients with a history of radiation, what we recommend is an artificial urinary sphincter. And that is a 3-piece implantable device where there's a button that goes in the scrotum that the patient has to push every time that they want to urinate. But it provides a much higher degree of continence for men, and it is the more common procedure that we use for these men. Okay, so let's talk about expectations. It's important to note that over 90%